هذا التقارب وصلنا ل 72 على الحكومه، واليوم لازم نعرف شغله انه هذه الحكومه امامها مهمات يعني عن كل الحكومات، انه هاي الحكومه ما بدك تنطريها اليوم، بدك تنطريها 10 ايام، لانه مطلوب منا مش والاعمال مش بيان الوزاري قبل البيان الوزاري شو هن الانجازات او انه برنامج العمل بدها تطرح الخطه العمليه بدها تطرح والسيف راهن ثقته قديش بيقدر يشوف انه هناك فعلا امل الحكومه وتتجاوز الازمه.
مشهد يبدو معقد اكثر بكثير ربما من تنظير جديد او محاوله.
Hi everyone. Hi everyone. So I'm hoping that I'm unmuted. Abir, can you confirm that please? Okay, you can hear me. Okay. Thanks everyone for joining us for the first webinar that we are having. It's the first webinar of our network, which is about governance, ethics, and conflicts of interest in public health. And our webinar today will be about the commercial determinants of health. We'll talk about definitions and risk about the commercial determinants of health. I am Melissa Mialon. I'm a researcher, a French researcher, and I'm currently a research fellow at the University of São Paulo in Brazil. I'm coordinating the series of webinars. And today we have two speakers. So before we start with the speakers, I'm hoping that Rima, who is coordinating the network, could join us and present about the network. If not, I can introduce you. I can introduce more information about the network. So I'm just waiting for the confirmation from Rima or from Abir to see if she can speak, please. Okay, so it seems that Rima has difficulties in joining us. So I don't have I have a slide in front of me, but I can't move them. So please, Javier, can you just make sure that you move between the slides, please? So I was saying that we are presenting about the commercial determinants of health. Abir, sorry, I can't see the slides from Rima, so I'm not sure where we are. Sorry for it's very difficult because we are trying to coordinate this webinar from different continents. So we are just having some technical issues. I'm just trying to see where the slides are up to so that I don't speak quicker than the slides, sorry. Okay, so I'll just open the slides on another document, and I'll just speak about them. So we are having a first very brief introduction about our network. Just trying to open the document so that I can go through that with you. Sorry. Okay, so who are we as a network? So we are the Governance, Ethics and Conflicts of Interest in Public Health Network. We are a group of researchers and advocates in academic institutions and civil society organizations, and we are concerned about corporate influence on public health research, practice, and policy outcomes. The network was established last year in February 2018, and it's supported by RDRC, the International Development Research Center from Canada, and we also got funding from Wellcome in the UK this year. So the network is hosted by the American University of Beirut, Faculty of Health Sciences in Beirut, Lebanon, and is coordinated by Rima. You've heard her name. I was referring to Rima, and Habir is also helping us with the network from Lebanon. So why the network was established? Because there is increase in arms from corporations and from its projects and practices. The corporate political activity of corporations includes lobbying, involvement in public health interventions, etc. And our speakers will speak about these different corporate practices. And they are corporations are also trying to find themselves as legitimate partners in education, in research, in practice and policy. So we call it the corporatization of academic environments, for example. And we have less and less resources, independent resources to do research. So there is a need for other sources, which could include commercial sources in research, for example. There is also an increased interest on the issue of commercial determinants of health that we will speak about tonight, and the corporate political activity, not only in academia, but also in civil society. So we formed this network based on all of these issues that we face. Abir, I don't have the slides on my computer, so maybe I don't know how we can do this. I'm just receiving a message from Lebanon that I should share the slides, but the slides are not on my side; they are on Lebanon's side. So sorry if you are not seeing the slides. We will share them afterwards if anyone is interested. It's just an introduction anyway. So we are just our mission as a network is to create in response to the rise in public-private partnership a model of good governance in the absence of sufficient attention given to the benefits and challenging of engaging with private sector actors. The network aims to promote institutional safeguards and measures that would protect public health in research, professional practice, and policy making. I will briefly skip the specific objectives, but we share, we collate, we promote, and we foster knowledge of industry interference. We document the governance, ethics, and conflict of interest issues that arise in the interactions between public health research, practice, policy, and industry involvement. And we also try to build capacity, set research priorities, and act as a forum for collaboration between researchers and civil society actors. And we also foster dialogue and promote evidence use through knowledge translation, monitoring, and evaluation. How do we work? We have a coordinating committee that meets every 3 months. And we have different core research team groups that meet regularly. And I'll just briefly speak about them later on. We also have workshops and symposia meetings over the year in different conferences where we represent about our work as individuals, but we also meet as a group in these conferences. And we have an annual meeting for all members every year. And we communicate as well, so we are developing our website currently. And we also work on Microsoft Teams, a platform where we share information instead of emails. And we also have a Twitter. So if you follow us, if you don't, please just follow us. We share information about all of the issues that are of interest to the network. So we had different meetings, annual meetings last year in Lebanon, the first one in 2018, and we had another one this year. In Lebanon as well, and next year in July we are going to have our 3rd meeting as a network. We have usually between 20-25 attendees in these meetings, but it's only the beginning of the network. So hopefully we'll have more people attending the meeting this year. What does it mean to be a network member? If anyone is interested to join us, you will have access to a global audience because we disseminate news of our members. We also participate in letter campaigns. We share publications. We also interact with each other. We exchange ideas, for example, and we provide support and feedback for our members, particularly early career researchers. If you want to join, you will have to fill in a conflict of interest form. So feel free to send us an email. On Twitter, we will share an email address. And hopefully we'll have more people joining us after the webinars. We have most members from Europe and the Americas. We like members from Southeast Asia and Africa. So if anyone knows researchers or public health advocates from these continents, please just invite them to join the network, because we would like to have also members from different continents and working on different industries. So it's important for us to have different perspectives as well represented in our network. What have we achieved as a network in the past couple of years? So we presented at different conferences, as I was saying. We also sent advocacy letters to different conferences where corporate interests are represented. We also granted seed funds to low and middle income countries researchers to conduct research, which are aligned with our research agenda. And we have our Twitter that is working well as well. We are tweeting regularly. And we have applied for additional funding from other funding agencies. Our challenges, because we have some challenges, everything we do is voluntary. So we are waiting for others to contribute to for our members to contribute to our network. We are also trying to better coordinate our activities. We need to identify our long-term visions and strategies and increase the clarity on the purpose and objectives that we have. We are also broadening our research interests and priorities. So this type of webinar will hopefully attract new members, and we could broaden all of this. We are also in need of a website. So we are currently developing our website, and which goes back to my first point about voluntary nature of our roles. We all have limited time and capacity, so everyone contributes with this time, and it's a challenge, but there are a lot of very positive aspects that we have also for our network. So I think Rima has joined us. I'm not sure. Maybe we will switch to Rima if she can speak, and if not, I will just briefly introduce the speakers, and we can start off with their presentations. Thank you.
Hi everyone. Thank you, Mel.
Thanks.
I'm sorry about the late joining late because of technical issues. I don't need to go ahead and speak. I think it's going well. So please continue, Mel. Thank you.
Yeah. Okay. Great. Thank you, Rima. I hope. Yeah, I got it right. I think so. I think we had already a very good presentation. I had the slides in front of me, so this should be fine. So we have two speakers today. The first one is Jen Leslie-Nicol. She's from the University of Melbourne, Australia. Thanks, because I know it's very early in Australia, so thanks for all of the participants from Australia and for our speaker. She will be presenting about, she will be sharing definitions about the commercial determinants of health and some background information. She's a food systems tutor in the School of Agriculture and Food in the University of Melbourne, and she's an expert on conflict of interest, corporate power, food and nutrition policy, public health nutrition, the food industry. So she will be the first speaker. I'm just presenting as well the second speaker. So the second speaker is Dr. Gary Fuchs from Ashton University in the UK. It's very late in the UK, so thanks everyone also from the UK for joining us, and thanks for Gary for being with us so late. I think Lebanon is even later at night, so thanks for everyone from around the world to join us for joining us today. Gary will explain what are the impacts and risks associated with the commercial determinant of health, and he is a researcher, political sociologist, political economist, reader in sociology and public policy. He is the director of the Center for Critical Inquiry into Society and Culture. C6 is the name of his center. His expertise is on corporate power, corporations, use of evidence in policy, corporations and governance, corporate regulation, and corporate welfare. So we will finish with a question and answer session. We will have 20 minutes through the end of the webinar, and the webinar is recorded, so it will be available online as well after the presentations. So I'm please asking Jen, you can start your presentation, please. Thank you.
Thank you so much, Mel. Certainly, I suppose, add some comments on the side if you can't hear me. Good morning, afternoon, good evening, everyone. Thanks so much for the opportunity. I'll dive right in. So I proposed this topic, I suppose, because in some of the readings, it seems as though the concept of what a commercial determinant of health is quite nebulous and contested at times, and I wanted to provide a bit more clarity around how broadly we could understand the concept and what might be some of the touchstones around that. So in terms of the audience, I suppose I imagine that some people have an interest in this, but perhaps haven't dived quite down into it. So do forgive me if I'm covering things that aren't perhaps incredibly new and novel, but I've hopefully added a little bit in there as well. So I'm Jen, and I guess there we go. One of the first things that I wanted to go through and do when I started looking at this was to see what actual terms were captured here. It seems as though the slide has been mooshed a little bit, but that's okay. We'll see how the other ones go. So we have the commercial determinants of health, a term that Ilona Cook-Bush has been talking about. But we can go back and see that a whole range of different terms have been used to talk about this in the academic literature, starting off with corporate disease promotion with Nick Freudenberg in 2005. But even if you go back and start trying to hunt down and look for these terms and how corporations have been talked about in terms of some of those risks and harms for public health, it goes back much, much earlier to the early 1900s. There's a whole interesting strain of literature around occupational health that I came across, as well as some interesting bits around women. So I started off with this very aspirational idea that perhaps I could do a little literature review before this presentation to give you a sense of what the literature is around this. I'll show you my next slide, which quite depressingly says I haven't gotten very far through that. But I thought it was interesting to sort of see the ascent of some of these different terms, and then also just to reflect on just how cluttered the space became quite quickly, I think. So what this graph is showing here is essentially the number of times that term has been cited in the literature since it first appeared. And I will say that some terms were in the titles of the papers, and so they appear much more frequently than some of the others. For instance, David Stuckler's paper, as well as a few of the others. But you can see that many terms have been introduced, and they just haven't been really picked up until we got that commercial determinants of health term. But that is by no means the only one or the first one in this particular space. I anticipate there might be more, but I suppose consensus around a term sort of suggests that a field is coalescing around something. So the extent to which we can anticipate in the next few years that commercial determinants of health, which now has its own little Twitter hashtag, ascends, we can see that the field is sort of coalescing. So this is my attempt at that literature review where I took all of those terms and then all of the papers that cited them. And this is just from Google Scholar, which captures the humanities a little bit better sometimes. So I started out with 3,500 papers, and then I removed my duplicates, and then I excluded the ones that were non-English, and then I have to go back and tweak a little bit. But as you can see, there's still far, far too many to actually do a real literature review. So I'm more than happy for any suggestions during Q&A as to other terms that perhaps should be included or excluded, as well as perhaps some other exclusion criteria that I might be able to use so I don't have to read through 2,000 papers. But I think it's interesting to sort of see the emergence of some of these terms. So one of the things that I looked at in terms of trying to understand what are the commercial determinants of health was what were some of the industries. Oh no, this slide is entirely different than the real slide. Sorry guys, 1 second. So I've got my other slides here. I'm just going to read off what some of the terms should be down the side. We haven't actually gone through with, I think when the slides got combined, they got edited a bit. So up at the top, we should have pornography. Then we'll have guns or firearms. Then we've got gambling, chemical, pharma, drugs, alcohol, cars or automobiles, tobacco, and food down the left in terms of what were the terms that came up most frequently when you searched for different industries with commercial or corporate determinants of health. And then even within the food space, because I research food systems and that's my particular interest, from top to bottom, we had snack, soft drink, junk food, fast food, ultra-processed food, which has emerged quite recently, and then processed foods down at the bottom. So it's interesting to see what sort of industries are associated most frequently with these terms and what sort of research has been done in that space more. And I'll say with this, I didn't differentiate between whether it was a case study going into great detail around one of these or whether one of these terms was simply mentioned once in those papers. These were just the terms that were associated. And I do intend to do more of a longitudinal study, hopefully, to see the extent to which some of these terms might rise and fall. I would imagine that, for instance, ultra-processed foods, because this term has only emerged quite recently, would be, you could see an emergence at a particular time. So lots of interesting things. Let's see how the other slides are going. So in terms of then looking at some of the harmful qualities of the commercial determinants of health, in the literature, there's essentially 4 different ways that I found this could be talked about. And again, I'm very interested in the Q&A to see if anyone thinks that I'm missing something or that other things should be added in. This is very much a work in progress right now. But we can talk about the products, the business practices, their corporate political activity or corporate political strategies, and then power. And I've added these 2 quotes from Miller and Herrick here because I did want to flag that one of the criticisms of the commercial determinants of health concept in a lot of the research is that it takes an incredibly negative approach to corporations, and it's not always like that. Certainly, I work for a university. It is a business. I like to think that that the universities are a public good. So I'm not trying to say that all corporations are problematic. It's that certain characteristics make them so. But Miller and Herrick do quite a good job of problematizing some of that, as well as some of the fragmentation within the public health community around that. So the first one in terms of products, oh, my slide survived, very exciting. So we often talk about the vectors of disease, and those industrial vectors as a concept really captures this quite well. But we can think even then within understanding some of those products that are problematic, such as soft drinks or alcohol or tobacco or what have you. they actually are harmful in slightly different ways. So you can think about products that might be harmful to simply exist. For instance, you could get lead poisoning or exposure to asbestos. And that will then impact individuals or communities in different ways. And so the extent to which this is an impact on a single individual consuming it, which is sort of that next category, it might contain harmful ingredients or addictive properties. That's quite different to how some of the other products might then cause harm, which is interesting. So most of the literature, and I'm saying, I believe most of the literature, I haven't finished the literature review, of course, yet, I believe considers products mostly in that harmful to consume sense. This is why we have so much literature on tobacco, alcohol, food, and pharmaceuticals. We can also think about perhaps that they are harmful to use. I didn't draw arrows, but this would apply to all of them. And it could harm both the user and others. So for instance, we could think about secondhand smoke in that context. We could also think about gun violence or automobile accidents. And then the one that I find most interesting really is that harmful to produce. So we're not just thinking about that end product then, but we're thinking about that entire supply chain that led to it. So in agriculture, we could think about greenhouse gases or pesticide exposure. For some of the chemicals, you could think about mining, pollution, chemical exposure. And I will say to include the caveat from a recent paper, the focus on products might be problematic because it tends to perhaps provide even more of a role for industry through product reformulation or creating better for you products. So tweaking some of the products without actually tweaking any of the businesses or political practices. Something that if you're interested in, I've just published a paper on that. So by all means, talk to me after. So products is one way. We can think about the harmful qualities. Another way to think about that is through some of the business practices. And I'll say this is my very rough cut. And so 4 ways that we can think about this. And again, this literature right now is just coming from those initial sort of, I can't remember if it was 14 or 15 papers now. I imagine that once the literature review is actually completed, this will be fleshed out quite a bit more. But corporations or commercial entities or businesses, there's that perpetual new product development, that they are always developing new products. In the food space, this is often a concern because of increased portion sizes, so we're seeing a reverse trend in some locations. You can think about the actual production process. So it could be your particular job conditions, exposure, occupational health, and those were certainly some of the very first things that concerned people in this space looking at commercial determinants of health. We've got environmental pollution, so effluents and waste, and then you can think about community exposure as well. So again, you can see that who's being impacted kind of depends on how we look at this. Is it the workers? Is it the community? Is it the actual environment that we live in? We can think about the distribution practices of corporations, so targeting low and middle income countries, targeting rural communities, the number, location, and time that different retailers are open. So that whole idea that their vector really fits in quite well in this space and distribution. And then we can think about some of those promotion strategies as well, which have been talked about quite a bit in the literature. But this shifts the lens a little bit from looking just at the products to looking more at some of the practices that corporations use. And to preempt myself just a bit, the size and power of the corporation plays an enormous role in the magnitude of some of these impacts here as well. So to talk about things that are probably more familiar, I think, in this commercial determinants of health space, we can talk about corporate political activity or corporate strategies. There are an enormous number of ways to think about this, chop this up. Certainly in the tobacco literature, there's the taxonomy of corporate political activity strategies that's being applied to alcohol, and Mel's been applying it to food, which is a very useful framework, and I know that Mel could probably talk lots about that. But I don't even have my animation. You shouldn't see that red dot. You shouldn't see the red circle there yet. So I've chopped them up, I suppose, into in that sort of ring circle, what were some of the outcomes that they're trying to do? So on one side, you can think about all the strategies they do to try to foster doubt about their harms, something that's talked about quite a bit in the tobacco literature. And a lot of that has to do with their influence around research and communication of that. We can also think about some of those strategies they have to promote a pro-business environment. And this is not necessarily linked to public health specifically. The doubts about the harms is very much linked to some of those health harms. But, you know, if you think about what we've seen with the Panama Papers or some of those corporate strategies more generally, trade policies, lobbying for tax breaks, avoiding paying taxes, all of this creates an environment that is more favorable to businesses. You can look at some of those more direct political strategies to oppose unwanted policies, and those tend to be some of the more obvious political strategies in terms of criticizing policies or lobbying. On the left-hand side, we can think about all those strategies to acquire political influence, which enable a lot of the other strategies. And then the last two, in terms of improving corporate political image and then offering industry alternatives, I've highlighted those on the left because they tend to generate quite different reactions from the public health space and from the public health community, whereas all of the others tend to foster reciprocal antagonism, where they're perceived as quite negative and problematic, and there's a really quite unified agreement that, you know, we're not happy when businesses are lobbying for tax breaks or funding counter research or lobbying the government. But when you look at some of the more, you know, voluntary initiatives, self-regulation, sponsorship of physical activity groups or health organizations, there's a lot more ambiguity and just not really great consensus that this may or may not be a problem. It's quite debated. And so just to think about that, you can see that the commercial determinants of health and some of these other terms are really often quite focused on some of those oppositional activities. So just to flick to that earlier slide, everything that's not in that red box is much more of that sort of oppositional strategies. And then some of those appeasement ones are much more different. And so my last two slides just talk a little bit about power. Again, I'm really sorry, I don't know why the slides, I think they've just been reformatted here. I won't go into explaining all the nuances of power, but power is essentially control of resources and control of decision making, and it can be exercised in a range of different ways. And the bits that I've highlighted in red are some of those resources that are a bit more at risk for corporations in terms of some of their relationships, in terms of some of their access to political leaders, and especially some of that legitimacy and trust. So in terms of challenging corporate power and trying to push back against that, those are some of the weak points for corporations that I've identified in some of my previous research. So my very last slide, and I don't necessarily, this is definitely not complete, but in terms of trying to think about how we can understand the potential impact of the commercial determinants of health, I see it as essentially two really big picture spectrums. On the one hand, you can think about the things that they do that might be beneficial to health, for instance, providing decent employment and good working conditions, as opposed to much more harmful to health. And then on the other hand, you can think about the extent to which they have an enormous amount of power and influence versus very little power and influence. So you're very, very small. You're very, very small organizations. So I've tried to fill this in with examples in each of my 4 quadrants, and they're completely imperfect examples of trying to think about, you know, well, perhaps Philip Morris could be my example of a very powerful but quite harmful organization. I've given the Bill and Melinda Gates Foundation as very powerful and beneficial to health, but I know that the beneficial to health is going to be very controversial considering conversations I've had about the WHO recently. You could think about a local fresh fruit and veg shop, perhaps, as very little power, but probably beneficial. And then I have a drug dealer as probably someone who has very little power but is harmful to health, but they're not really business, I suppose, is a quite stretchy concept here. Anyways, this is what I have so far. And I'm more than happy to discuss anything, to get feedback, suggestions, comments, but I will hand over to Gary now. Thank you. I think that was 20.
Can you hear me? Yeah, super. And I'm not entirely sure how I moved the slides.
On the, I don't know if you can still hear me.
I can hear you. Want to share my screen? Can you see my slides? Can you see my slides, Jen?
Yes.
Yes. Thank you. Okay. Look, I've been asked to outline the risks that corporations pose to population health and health policy. I was in fact asked to do a little bit more, but I think this is all I'm going to be able to get through in 20 minutes. And I want to begin by exploring these risks by very briefly reopening some of Jen's observations, particularly on the challenges to circumscribing the field. Now, it's possible to do this by taking most, but not all, definitions of the commercial determinants of health or their equivalents. I've selected Kickbush's definition simply because it's the most influential. You'll note that the definition appears to focus on consumer products, and this reflects the fact that interest in the area among public health scholars grew out of a recognition of the political value in reimagining behavioral risk factors associated with tobacco, alcohol, and processed foods, and instead sort of focusing on the commercialization and commodification of these products. Now, the political value, of course, resides in the fact that it shifts the focus away from individual choices onto the composition and marketing of products that are implicated in non-communicable diseases. And obviously beyond that, we have the producers of these products. And we can talk about this in different ways. We can use the concept of vectors or upstream factors, but irrespective of the language we use, we're essentially doing the same thing, exploring the underlying socioeconomic, commercial, and organizational drivers of poor health. Now, in public health terms, there are, of course, good reasons to focus on tobacco, alcohol, and food industries. In 2017, 11 million deaths and 25 million disability-adjusted life years were attributable to dietary risk factors. Globally, alcohol use was the 7th leading risk factor for both deaths and DALYs in 2016. Among 15 to 49-year-olds, alcohol use was the leading risk factor globally. In 2015, 1.5% of global deaths were attributable to smoking, of which just over half occurred in China, India, the USA, and Russia. But one problem, of course, with this focus, as sort of Jem mentioned, this focus on consumer products, is that it doesn't cover the full range of health problems associated with corporations, such as work-related injury and ill health, climate change, air pollution, and harms associated with the pharmaceutical and agrochemical industries. And of course, I could go on. And what's often overlooked is that in population health terms, both the actual and potential health impacts of these issues and industries are huge. So, for instance, estimates put the number of work-related deaths at about 2.78 million, the lion's share of which, 2.4 million, is made up of work-related disease. This only tells us about death, of course, rather than disease burden. The best data we have for this are WHO comparative risk assessments, which estimate burden of disease as part of the global burden of disease project. Now, to ensure consistency, the GBD project has stringent data requirements which limit the risk factors evaluated. Occupational risks are ranked 11th in terms of total disability adjusted life years for men and 13th for women. And as you can guess, the economic costs associated with this are huge. So in Britain, the total economic cost of new cases of work-related cancers alone in 2010 were estimated at approximately £12.3 billion, 98% of which were borne by workers. Equally, climate change is ultimately a function of concentrated corporate power, policy failure, and oligopolistic energy markets. Just 100 companies are estimated to have been the source of more than 70% of the world's greenhouse gas emissions since 1988. I've outlined some of the risks to health on this slide associated with the phenomenon. One of these risks, food security, should be of particular interest to public health scholars and advocates. Crop yields are predicted to decline because of changes in rainfall, severe weather, and increasing competition from weeds and pests. Livestock and fish production are also projected to decline. The effect, of course, is a rise in prices, or will be a rise in prices, which increases food insecurity. In such situations, what happens is people cope if they can by turning to nutrient poor but calorie rich foods, or by simply going hungry, with consequences ranging from micronutrient malnutrition to metabolic syndrome. Nutritional value of some foods is also projected to decline. Elevated atmospheric CO2 is associated with decreased plant nitrogen concentration and therefore decreased protein in many crops such as barley and soy. The nutrient content of crops is also projected to decline if soil nitrogen levels are suboptimal, with reduced levels of nutrients such as calcium, iron, and zinc. In short, we need to look beyond tobacco and alcohol and diet-related diseases, important though these are, in order to fully understand the commercial determinants of health. My feeling is that this isn't something being picked up enough by scholars working in this area, and I suspect one reason for this is that our understanding of the contemporary global economy is underdeveloped. And this is a roundabout way of leading me into the sort of second weakness of Kickbush's definition. By specifying the private sector rather than, for instance, transnational corporations, it potentially underplays the importance of corporations' economic, political, and cultural power. And this sort of strikes at the very heart of the value of the concept, namely that it brings together two of the most important issues in the world today: the emergence of the corporation as the main organizing institution in contemporary societies, and the increasing inability of nation states to mitigate the harms that corporations cause. One way of getting a sense of the economic power of corporations is to compare nation states' revenues, mainly taxes collected, with those of corporations. Past efforts have sought to do this with GDP, which doesn't work for reasons I'm happy to explain later. In 2016, by this measure, the global top 100 comprised 29 states, so 29 countries, nation states, and 71 corporations. Admittedly, the world's wealthiest nation states dominated the top of this ranking. Nonetheless, Walmart had higher revenues than both Spain and Australia. Equally, in 2009, UNCTAD calculated that the sales of the top 20 non-financial corporations were worth $4.3 trillion US, equivalent to the combined national expenditure of the poorest 163 nation states. Finally, Jeffrey Harrod has pointed pointed out, or we pointed out in 2006, you had one corporation that accounted for more than 40% of global sales. So what does this mean? First, it implies the largest corporations not only have a lot of market power, but they also represent social entities which, or through which much of the world's economic activity takes effect. Second, transnational corporations don't just underpin national economies, but the global economy. And third, they're responsible for providing most of the goods and services that people consume, and of course a lot of employment and tax revenue, which essentially underwrites their cultural and political power. Now, the political power of corporations is important because we know that government policies work in public health terms, or more accurately, government policies which seek to manage the market environment for corporate products and activities. They typically work precisely because they reduce sales and increase corporate costs. In short, they work by, or an epiphenomenal effect of how they work is that they reduce corporate revenue. And what we know from an almost a century's worth of research is that when this happens, corporations mobilize politically. Now, work within public health to understand this response, I think, is still very much in its infancy. Most of the recent work in this area centers on mapping corporations' political strategies. So we have a series of overlapping typologies based to varying degrees on earlier work on the tobacco industry. Some of these typologies look quite complex, and of course it's important to know what corporations are doing, but ultimately these typologies are descriptive. They don't tell us, for instance, much about strategy selection, nor what is effective and why. On this slide, I've reproduced some of the instrumental techniques outlined in the policy dystopia model, which was developed to understand tobacco industry efforts to shape policy. The model describes a range of insider and outsider techniques which speak to different audiences. Amongst other things, what it doesn't do is explain how institutional and policy contexts shape which of these strategies corporations select and in which combinations. It doesn't, for instance, highlight how and under what circumstances corporations venue shop, that is, seek out decision-making venues where social actors can best press their case for specific policy preferences. At the national level, most of the companies that we're interested in will seek out venues that supersede or circumvent health ministries with a view to exploiting the different priorities of decision makers in non-health departments. What these typologies do tell us, however, is that industry political activity is heterogeneous and plastic, which allows companies to adapt their approach to altered politico-institutional conditions. What does this mean? Partly that the availability of a wide range of strategies allows companies to trial qualitatively different techniques to optimize policy influence. These can work as alternatives or in combination with other techniques. Importantly, though, it also reflects a capacity for political innovation in response to changing policy contexts. So the tobacco industry's increasing use of third parties, for example, reflects, but is not wholly reducible to, admittedly, its declining political legitimacy among policy elites. Some of the more sophisticated typologies, and this includes the dystopia model and some of Mel's and Ben Hawkins' work, also explore the interdependence between techniques and messaging. In other words, what corporations do and what they say. To this end, the underlying message of most corporate political activity can be reduced to a simple cost. cost-benefit narrative. The side as a whole, whilst its benefits will be limited or even non-existent or simply enjoyed by the wrong types of stakeholders. The other achievement of these more sophisticated models is that they highlight the fluidity and interdependence within and between techniques and messaging. So, for example, generating support from a variety of constituencies requires companies to generate a whole range of constituency-tailored cost-benefit arguments. The constituencies then give voice to these arguments, which strengthens their credibility and renders them more persuasive. The key for public health advocates is to anticipate these cost-benefit arguments and target them appropriately. Perhaps so the major weakness of these models is that they only describe what we can see. And the fact of the matter is that in practice, the power and influence are typically diffuse, indeterminate, intangible, and indirect. For instance, most models don't address efforts to reshape policymaking governance. There are two key policy-related phenomena to consider here: corporations' efforts to embed cost-benefit analysis within contemporary policymaking under better regulation and good governance agenda. This was initially a sort of an idea that emerged in the US, and their efforts to both shape trade and investment agreements and their interpretation. What we know, for instance, is that efforts to embed cost-benefit analysis and mandatory stakeholder consultation within EU policymaking were fiercely lobbied for by corporations with big impacts on public health. I'll keep going, I think, even though my slides have disappeared.
Sorry.
Yeah, so these were from the processed food, chemical, oil, pharmaceutical, alcohol and tobacco sectors. And when we look at efforts to extend cost benefits, analysis and mandatory consultations through international trade and investment agreements, we find the same companies pushing for the proposals. And the reason they've been pushing for these measures is that they expect them to increase the priority given to their interests relative to broader public interests, such as health and the environment. And their expectation is that they'll achieve this partly by weakening the precautionary principle. So these sort of mechanisms weaken the precautionary principle, and partly by directing policymakers to their preferred sources of data. And the basic idea to grasp here is that corporations have an information advantage in policymaking relative to policymakers and other social groups. By information advantage, I mean that they possess or control production of a lot of information that's essential to working out policy impacts. And there are several sources to this advantage. It's partly a function of policymakers' capacity constraints. Even in high-income countries, policymakers have to spread their resources across a diverse range of policy areas at the same time. This contrasts with corporations, which, in addition, of course, to being well-resourced, only have to focus on producing evidence in respect of specific policy issues that affect them. In addition, corporations get costless information as a simple byproduct of their commercial activities. So corporations automatically possess data about costs and demand and technological expertise that is important for political decision making. Finally, because political decisions are often very important, the specific industrial sectors, or for specific industrial sectors, corporations have strong incentives to pool resources to produce research relevant to policy issues, and this helps them to shape the evidence base of policy decisions. Now, there are several key points here. First, power is being exercised under conditions of very low visibility. Second, modes of influence are relatively technical. And third, corporations are effectively rigging the rules of policy making in their favor. And this is exactly what we find in the context of corporate influence in trade and investment agreements, investor state dispute settlement arbitration, for instance, is not transparent. The concept of regulatory chill, which is essentially an absence of decision making, is very difficult to measure. And the issues can be quite technical. So to conclude with one example, which has been looked at in a couple of excellent papers by Anne-Marie Tho and colleagues, trade policy usually relies on standards to guide definition of what constitutes the necessary and least trade restrictive requirements on traded goods. In the case of food, the Codex Alimentarius Commission constitutes the internationally recognized standard-setting body for definitions relating to and requirements for food. Discussions are currently underway at Codex regarding the potential development of guidance on front of package food labeling. And what the evidence suggests is that these discussions are taking effect through industry-oriented framing, which is essentially facilitated by the governance structure of Codex, which fosters industry influence through multiple, although potentially inadvertent mechanisms, such as the cost of participation, offers, and multiple national, global avenues for industry influence. So understanding industry risk to policy has come a long way, but the plastic, varied, and institutionally promiscuous form of corporate political activity means that we're still a long way off, and we'll always be a little way off from understanding and countering it effectively. And I think that's my 20 minutes. Thank you.
Thanks, Gary.
Thanks, Mel.
Can you hear? Yeah, okay, you can hear me. Thanks. I think it was very, very interesting. Thanks to Jen as well. It was very, very, very interesting and important information that you shared, and I can personally put this into perspective when I see the work I'm doing in Latin America. So I'm sure our participants found it very, very useful and very informative as well. I'm hoping everyone enjoyed the presentations. We will have a session of question and answers. We already had some questions. Maybe before we start with the questions, I just had there were two comments. One from Tony, I think Tony Brown from Newcastle in Australia. He has written a paper where and I think it's for Jenny the comment. He has written a paper where he discussed about profit-driven determinants of poor health. As a new term in the commercial determinants of health. And Anena from Bristol in the UK, she's currently looking at the commercial determinants of obesity. So that's two suggestions we had from our audience. Now a question for you, Jen and Gary, please. So we had the question, what does the literature look like when compared across settings when we talk about commercial determinants of health? So rural versus urban, developing countries versus developed countries. Would you have any suggestion here or comments, Jen or Gary, please?
Help me if I'm not.
What do you have to
Yeah.
So I suppose I'd probably first ask for clarification around that in terms of whether the literature has originated from the Global South or if the literature is about the Global South, which might be slightly different. But I would say that, and this is what Gary would have noted as well, is that the strategies are very similar if you're looking at some of those corporate political strategies. This is certainly one of the things that I would hope to look at in that literature review, is to try to add some nuance in terms of how this has changed over time, how this has changed depending on which particular context we're looking at, Gary definitely pointed to the venue shopping. So the extent to which you're in a Global South institutional context versus a Global North institutional context, as well as some of those business strategies. Certainly within the world of food, you see some very interesting novel distribution strategies in terms of that, the last mile aspect that both Coca-Cola, Nestle, and a lot of major food corporations have used that aren't seen as much in the Global North. I'm not sure if that adequately answers.
Okay. Do you want me to go?
You can, Gary, yeah?
Thanks, Mel. Okay, so there were 3 parts to the question. The first asked us to say something about what the literature says about the differential effects between rural and urban areas. I don't think the literature does address that distinction, to my knowledge, or it certainly doesn't address it in a particularly developed way. The other part of the question centered on differences between low and middle income countries and higher income countries. Again, the literature doesn't really seek to sort of explore and therefore explain differences explicitly, and when it does, it doesn't do it in a particularly developed way. I think that's a fair summary of the literature. I would also say that the literature on low and middle income countries is probably slightly less developed than it is on higher income countries still, and that clearly needs to be changed and changed quickly, simply because the sort of risks have very quickly shifted and continue to sort of shift onto low and middle income countries. Now, if we look at the way in which corporate political activity has been explored in different industry sectors, then the techniques are sort of largely the same, although the language that's used is commonly different, and that is because you have people from different disciplinary backgrounds writing in different areas. I think it's still fair to say that empirically we seem to know more about what tobacco companies have done relative to other industries, and this reflects the public availability of formally confidential tobacco industry documents. I mean, I think you may be able to make an exception for the pharmaceutical industry, although much of that literature tends to focus on the science as opposed to other political tactics. And the literature on asbestos, the asbestos industry, is also sort of quite developed, and that also reflects the public availability of formally confidential industry documents as a result of litigation.
Thank you.
That's all I have to say on that.
Thanks.
And obviously, I'm oversimplifying for anyone who's still listening.
I think, I mean, we still have our, most of the participants are with us. So I'm just continuing with the questions. We also had a question, considering the development needs of the Global South, do you think health equity is realizable? And does these corporations operate within ethics regulation in the Global South?
Right. Within a what regulation?
Do these corporations, operate within ethics regulation?
Ethics.
So, yes, ethics.
Do they behave ethically, and do they comply with regulation as it exists in low and middle income countries? Is that right?
I think that's the question. Yeah, I think, yeah.
Okay, doke. Jen, do you want to go first?
I was gonna say, I thought the question was, is equity possible? And I was like, recipe for that. Big question. No, you take it, Gary. I'm formulating my response.
Okay, no is the short answer to the first part of the question, I think. But obviously health equity is a far broader issue than the commercial determinants of health. I suppose my answer to that part of the question will also depend on what sort of time frame you have in mind, and I would also make the rather facetious observation that I think we're all doomed anyway as a result of climate change. So yes, we may achieve health equity of sorts, but through a leveling down as opposed to a leveling up if your time frame is 50 to 75 years. On the issue of compliance with regulation in low and middle income countries, again, much depends on what countries we have in mind, what industries we have in mind. By and large, corporate regulation tends to be weaker in low middle income countries. I mean, that's again a gross oversimplification, but certainly that's what the best literature on regulatory competition tends to suggest. And then the other part of the question, of course, is, well, what do we know about enforcement in these countries relative to higher income countries? These are empirical questions, and I don't think the literature is as developed as it could be. What we have is sort of case studies, and the case studies suggest that on balance, enforcement of weaker regulations tends itself to be weaker in low and middle income countries.
Yeah. Okay. Thanks, Gary. I think we will take one last question because we have little time left. I mean, we are already over time, so just one last question. One participant was asking, now that we know all of that evidence, how can we use it to assist different groups in decision making, for example, in research or in our public health advocates? And the participant was mentioning the FCTC, the Framework Convention on Tobacco Control, which is quite clear about the interactions between policymakers and the tobacco industry. We don't have an equivalent, for example, in the alcohol or food industry. So how can we use that evidence about corporate strategies to influence policy and research, etc., to try and diminish that influence?
I suppose one thing, I've had some meetings with Australian health advocacy groups, and one of the things we've talked about is the capacity to anticipate what corporate responses are going to be, to try to get that 1 foot ahead in terms of, if you're proposing this particular policy, what is going to be their rebuttal, what is going to be their voluntary alternative, so that you won't be faced with them saying, look, we've done this amazing voluntary policy. You can sort of say, we've launched this policy and we anticipate that tomorrow they're probably going to be launching this thing they've been sitting on for 6 months, waiting for exactly this particular time. I say this because this just happened a few weeks ago with Australia's obesity strategy. So I think some of that anticipation and understanding the strategies works. I will say, Claire Herrick's research does make me reflect a bit around the us versus them approach that often seems to come out. And I've had conversations with different public health researchers in this space, and I have not yet come to grips with how, and I know this is what the GECI-PH, the long-winded acronym that we have is working on in conflicts of interest, of with whom do you partner or work with and under what circumstances? And I do think that is a very important question to think about here. But my short answer is, at the very least, understand what the strategies are so that you can anticipate them and perhaps come up with a more strategic response strategy, or even borrow some of their strategies as well. Certainly, CUNY University in New York is doing some amazing counter-advertising campaigns that I absolutely love, similar to the Bugger Up of Australia tobacco advocates.
Yeah.
50 years ago.
Great. Yeah, no, I absolutely. And so I think we will close here. Just to say that, you know, what you've discussed about is one of the main topics of our network. So in the next webinars, we will be discussing about these mechanisms or these solutions to address the industry interference, industry influence on policy, etc. So thanks a lot to our speakers. Thanks a lot to the coordinating committee in Lebanon. I know it's very, very late in Lebanon. So, and thanks for the participants. We are late, but thanks for everyone who stayed with us. And we hope you enjoyed our first webinars. Thanks, everyone. Bye.
Thanks, Mel. Thanks, everyone. Take care.
I'll share my proper slides at some point. Happy to do that. I'll email you, Gary.